So I'm going to take this off so I can speak a little bit with some clarity. Pastor, thank you so much for inviting us over. We were talking to Mayor Merrifield, and some of the things that come out of the pandemic are blessings in disguise. And I can tell you without the pandemic that I would never have crossed paths with your pastor. And he's just a class guy. And I can tell you, he truly loves his congregations. So I want to talk to you a little bit about things that have changed obviously since we were here the last time, and I think probably for the better. We have now 2 vaccines that we can use, with another one probably being on the market this week. I know there's a lot of questions around the vaccines and the administrations and all the other things that go with that. I think we did a really pretty good job with the social distancing and the face coverings and those things to decrease the risk. When we decrease the risk, we decrease cases. When we decrease cases, we decrease deaths. So we did, I think, a pretty good job, although I have to be honest with you, I think maybe we could have done better. So now we are in the vaccine phase. I'll talk to you just a little bit about that and how that's going. And essentially what we're doing to reach those who perhaps could not be reached. And I see Tiffany back there. So what we started doing, we know that for whatever reason, and we could talk about it all day, I did ask Pastor, I said, how long can I speak? And he didn't respond, so we'll be out about 3 o'clock. So, what the uptake in the vaccine among the minority, the African American population, is really low. And we can talk about all the reasons. We can start with 1932, Tuskegee, and all of those things. But as the pastor said a few minutes ago, it does us no good to look in the past.
Amen.
We got to look forward to the future.
Amen.
And so if we do that as a group, then I think we'll be just fine. So Romelia Hodges, whom I think all of you know is a really good community activist, she had reached out to me and said, Lloyd, I have 4 people that I'd like to get the vaccine for. How can we do that? How can we make that happen? And I'm thinking, well, that's a place to start. However, I have a little bit of a plan. And so I talked to Secretary Crouch, and we ran it by the governor's office, who all of you know that they're really supportive of African American vaccination rates, getting those up. So I asked Secretary Crouch, I said, why can't I not withhold X number of doses at the conclusion of our community clinics for the African American population? And so Romelia and I, we had some really discussions around that. And I can tell you, she and Tiffany did a tremendous amount. They deserve all the credit. I do.
That is Sister Tiffany Walker. Could you stand, Sister Tiffany Walker, Sammy? Give her some praise. Man, for the beautiful woman who was looking, what an awesome couple. You look like Michelle and Marion of that dude.
So they did a really good job of getting what we call a list together. And then when I was talking to Pastor, some of the challenges that we have to overcome, that we've known forever, so many barriers to health care. So the challenge for us is, how do we overcome those barriers? How do we make it more easily for folks to be vaccinated who want to be vaccinated? Understanding their fears about the vaccine and so many things. So my challenge was to how can we make it more equitable for those folks to get the vaccines? And so when I talked to Romelia, we said, listen, can we just have like separate clinics after our clinic? And the idea was to make it more familiar. And we did that last Wednesday. And I think we probably had close to 80 vaccinations on Wednesday. Then we had, I think, probably another close to 20, I don't know, about 20 probably on Friday. So my guess is there's probably 100 vaccinations in the African American community that we typically didn't have. And that's really phenomenal. So again, Romelia and Tiffany, those girls did all the work. We just did the delivery. So that's where we are in terms of the vaccine. Our plans are to move forward with what we have gotten started. The challenge becomes is the vaccine availability. When do we get it? And I can just tell you, we canceled the clinic Friday before last because the vaccine was stuck in Tennessee in the snowstorm. We didn't get it, so we had to cancel the clinics and do those things. So sometimes if you get a call from Tiffany or Romelia, like just a few hours before clinic starts, it's because we are planning for clinics, yet we don't have the vaccine to deliver those at those times. Sometimes until we just get it right before the day before the clinic goes. So, I would encourage you, getting the vaccine is always going to be an individual decision, but I would encourage you to really think about it. Pastor and his wife had gotten the vaccine. I got to tell you, in all honesty, I truly believe it's safe. And I know we can talk all day about, well, they rushed it through so quickly. Well, that's true. However, the foundation for vaccine development was already in place, and all the government did was cut the red tape. And I think all of you can understand how much you can get accomplished if you just cut the red tape. But I firmly believe that it's safe. I would not have gotten it myself had I thought that it wasn't safe. So sometimes we've got to consider the alternatives. If we don't get the vaccine, there's always a higher risk, a higher probability of death. So the vaccines work, and I've got to be honest with you, from a public health standpoint, it doesn't matter where it's Pfizer, Moderna, or now Johnson & Johnson. Although with Johnson & Johnson coming on board, I think it's going to be a lot easier to administer. So I hope the rates will come up. So I would just encourage you to think about getting the vaccine. There's always the potential for adverse effects, but I can tell you, we've did thousands and we've had 0 adverse effects in our county.
Amen.
So that's
Praise God.
really good.
Amen.
So they're safe, they're effective. And I know if you look at the Johnson & Johnson, you say, well, they're about 72% efficacy rate. That you really can't compare. We're comparing apples to oranges, and that really doesn't work. Here's what I can tell you. There's been 50,000 in the trials. Not a single one resulted in hospitalizations. Not a single one involved any deaths.
Amen.
That should be all we really need.
Amen.
So I think we've came a long way. And I know it's been tough. It's been tough on everybody. Just kind of how God works. I was thinking about some of the comments that I wanted to make and listen to the pastor, so it just lets me know that we're on the same page. So all of us have to overcome adversities in life. And some we bring on ourselves, some just because of happenstance and circumstance. So I want to encourage you just a little bit. Remind you of Paul's words when he was nearing his last days in his letters to Timothy. He said, what did he say? I have fought the good fight.
Yes, sir.
I have finished the race.
Yeah.
So we're in a fight. We're in a battle, I guess. And he has kept the faith. I want to encourage you that even though we face adversities in life, trials and tribulations, keep that one verse in mind, because it's then and only then when we finish the race that we'll be victorious and we'll be able to overcome what we have before. So, lastly, I want to tell you a little bit of a story. You know, a lady was diagnosed with a terminal illness, and she was on her deathbed, had only a few days to live. She called her pastor and said, Pastor, would you come over and I'd like to talk to you for a few minutes. So he went over and she began to tell him what she wanted for her services, what songs she wanted sung, how she wanted to be dressed, how she wanted to be placed in the casket, what time of the services, and gave him all the detail. Then she said, and Pastor, if I could ask for one other favor, what is that? He said, would you please put a fork in my right hand? Looking bewildered, he said, sure. Let me explain to you why I have that request. When I was a little girl, my grandmother would always take me to church dinners. We would have the dinners, and she would lean over and tell me, hang on to your fork, the best is yet to come. And I can tell you, as Christians, let's endure, let's run the race, let's keep the faith, because I'm telling you, the best is yet to come.
Come on, give him some praise. When you stand on your feet, man, we're really blessed. There's a whole lot of the cities, they can't get a health department official. And guess what? He's not running for office or anything, so I want to make that clear. He's there because by the grace of God. And can I just tell you something? God strategically placed, just like he did with Mrs. Hodges and also with Mrs. Samuel Walker and all of the people who we're going to honor today. God is just strategic. God makes no mistakes. I even believe he's using this and even social unrest to bring us closer together. Man, I love this guy. I know he can preach, because then I might bring him back next Sunday because I'm a little tired. But I thank you for the words. Your words have encouraged us, and he's been a friend. And can I help someone? I want to give you a glimpse of what heaven, if you had a snapshot of heaven, it's going to look like this.
There you go.
That's what heaven, I'm trying to help somebody. I really am. It ain't going to be no Episcopalian, ain't going to be no Baptist, ain't going to be no Kojic Church of God in Christ. It's going to be all God's children. Yeah, and guess what? If you ain't going there, you're going there. So I hope, and guess what? I was talking to the former pastor, great pastor of this church, Sister McKinney, because Miss Marion was reaching out to her, and she said, Pastor, we all got a date on the calendar.
Yes, sir.
And she said, but I just want to do the right thing. But I thank Sister Marion for reaching out to me to reach out to her. But I thank God for him for just coming and sharing that with us. But I want to make it plain though, guys, because when you look at the bigger picture scheme, 60% of whites have been vaccinated, 5% African American.
Yeah.
That's 55%. That's huge, isn't it, Mrs. Hobbs? That's huge. we don't pick up the phone with people like Miss Simmons Walker or Mrs. Hodges, or he comes out and reach. So guess what? We all need to be vaccinated because it's going to help us. But can I just give you a little heads up? I did get vaccinated, but I'm glad that over 2,000 years ago, Jesus shed his blood on Calvary's cross. And when I gave my life to Christ, I got vaccinated. I'm not a preacher today, but I'm just telling you, I'm telling somebody. So I pray to somebody today, if you want to get vaccinated, make sure you get Christ in your life too. We think I give him some praise, we praise God for him. And we ain't supposed to do it, but we do it anyway. Thank you.